All right, good evening, everyone. My name is Joe Durant. I am a senior instructor for the Center for Pain and Stress Research, as well as a researcher. And tonight we're going to be doing a tutorial on the Dolphin Neurostim. So I would ask you guys to all look at your screens and hit the mute button so that there's no background noise. Otherwise, everything you say and do in your house will be recorded tonight. All right, looks like everybody is muted there. So if you guys have any questions, we're going to do about an hour of tutorial here, and then there'll be about 30 minutes for questions at the end. You guys can either type the questions down in the chat section, and I'll get to them once we get to that portion of the presentation, or you can ask them in person. So either one works. So for right now, if you have a Dolphin Neurostim, go ahead and pull it out. And let me adjust the camera here just a little bit, and we're going to go over this device from top to bottom. I'm going to teach you guys a little bit about how to use all the functions on it, how to find treatment points, how to do treatments, and also how to do a basic scar release and set up your vagus nerve stimulation kits. We have a lot of ground to cover tonight. So let's find my little pointer here. Let's see here. So starting at the tip of the Dolphin Neurostim, we have biocompatible alloy tip. You will notice that if you push on it, it does compress in, so it is spring loaded. Because there's a spring and conductive medium in there, we do recommend that when you clean these, you don't pour liquid down into here, but you use just alcohol and a wipe of some kind to wipe it down thoroughly. Moving up from there, there's a black button. You'll notice that when I push that button right there, absolutely nothing happens because the device is off. And when the device is on, I'll be using this button to activate treatments. But until then, nothing will happen. There's a roller switch behind this. So this roller switch does several things. Number one, it turns the device on. Number two, it controls the overall intensity of the stimulation you're going to get. And number three, it turns the battery test on. So I'm going to turn this on for you. And so you can hear I get a nice steady tone. And then I'm going to flip the device over, and you'll notice on the Dolphin Neurostim, there's a nice steady green light right there. If you ever turn this device on and that light is not green, that means it's time to change the battery. So while we're on the topic, I'm going to show you how to change the battery in the Dolphin Neurostim. You're going to need a standard 9-volt battery. We highly recommend that you use Panasonic, Duracell, or Energizer batteries. Anything other than that can cause you problems in one way or another. So I'll go over that in a minute. But you'll notice on the Dolphin Neurostim, there are 2 screws at either end of them. We do have a lot of problems with people taking the screws out of these devices trying to change the battery, which absolutely befuddles me, because if you read the directions and look, you will see there's actually a battery compartment here that actually has a little hole in there that allows you to take a coin and just pop that compartment open, and you'll see the battery. If you happen to take these screws out and attempt to change the battery, it will void your warranty, and pieces will fly out, and you have to send it back to us and pay us to put it back together for you. So I do recommend that you just use the battery compartment rather than a screwdriver. All right. So once you get your Dolphin Neurostim opened up, just give it a little slap. That'll drop the 9-volt battery out. You can take your new battery and put it in there. There is a little diagram in there that shows you the orientation of the battery. And the reason you wanted to use Duracells, Energizers, and Panasonic batteries is because not all 9-volt batteries are the same size. Seems kind of strange, but that's the way it is. AA batteries, AAA batteries, D batteries, and C batteries are all the same size. But you'll notice in a lot of devices that take 9-volt batteries, they have a couple little wires that come out and a little spongy little pad that goes onto the batteries. So we did away with that because they always break. People have problems with that. So we built a battery compartment that exactly fits 9-volt batteries. Only we didn't know, because it's not really common knowledge, that not all 9-volt batteries are the same size. So if you get a battery that's too short, it's going to rattle around in here, and you're going to get intermittent contact, and you're not going to be able to do very good treatments. And if you get a battery that's too long, there's actually a plastic post up in here that you can actually break. That's part of the construction of the device. So we do recommend, like I said, Energizers, Duracells, or Panasonic batteries. So I'm going to put the battery in. I'm going to turn the Dolphin Neurostim on. I'm going to turn it around. Got a nice steady green light there, which tells me I've got good battery power there. A standard alkaline battery should last in treatment. So I use these. I'm a therapist, and I use these. Let's see, probably about 30 to 40 treatments a week. And one of the batteries in here will last me anywhere from 3 to 4 weeks. So they do last quite a while. If you're doing vagus nerve stimulation every day, they'll run down a little faster than that, but they do last quite a while. All right, so you got your on and off switch here. The more you roll this, the more intense the stimulation is once you activate the treatment. So now that the device is on, if I push this button down right here, you'll notice that I have a beeping and there's a flashing light there. So as long as I'm holding this button down, I am actually doing a Dolphin Neurostim treatment. I'm treating trigger points, motor points, acupuncture points, or doing scar treatment. But as soon as I release this, it stops. So unless you're holding this button down, you're not really doing much. Now, this device does have a point finding capability. You need to use the point finder first before you push this button down. So I'll go over that in a couple minutes. Up from there is a little black button. If I push that button down with the device on, you'll notice the device goes silent. But if I flip it over, you'll see that it's still flashing. So this is like a continuous treatment mode, and it's timed. It runs for anywhere from about 12 to 14 minutes. So if you're going to be doing something like vagus nerve stimulation, you can just hit this button and read a book or hang out in a chair. Or if you're a therapist, put this on your patient and go about doing some stretching or some myofascial work or stick needles in your patients or whatever it is you do. And when the treatment is up, it'll revert back to a steady tone to let you know that that cycle is over. And at that point, you can either turn the device off or you can hit this button again and run for another cycle. Initially, we didn't have that feature on the devices, and people were using this at nighttime, doing their vagus nerve stimulation at night. And it does make you a little sleepy sometimes, and they would fall asleep with the vagus nerve stimulation on and do like 6 hours of vagus nerve stimulation, which can make you pretty sleepy the next day. So anyway, we put this continuous treatment mode on there with a timer. All right, moving up from there, well, that's all the features here. So if you flip the device over, you will see there is a metal pad right here. When you are doing treatments, unless you are specifically using electrodes that look like this, these little electrodes that fit over here, unless you are using these, when you are doing a treatment, you must have your thumb on this metal plate. We do not recommend putting your fingers on it. We recommend using your thumb because it allows you to hold the device like a pen and use accurately. You use a point finder. If you start trying to flip it around and do other things with it, you're going to find that it's a lot more difficult to find treatment points. And I've been using this system for, gosh, probably 25 years now. So this is by far the easiest way to hold the device. All right. There are also 2 slider switches here. And let's see if I can get the computer to focus here for you. You'll notice that the bottom one says wet, normal, and dry. So that controls the sensitivity of the ohm meter. This will find myofascial trigger points, motor points, and acupuncture points, all of which are basically the same thing. And it does that by measuring how conductive your skin is. So if I pull this across the skin of somebody who's really sweaty, that's salt water. And so that's going to make their skin very conductive. So I'd want to put this on the wet settings to make it a little less sensitive. On the other hand, if I'm someplace cold and I'm working on people who are older and have drier skin, then I probably want to slide it over the drier setting so that it's easier for me to find points, so it makes it a little more sensitive. Now, where I am, I'm in the States. I live down in Georgia. It's generally pretty humid down here, but I'm normally inside where there's either air conditioning or heat, so it's a little less humid. So I just leave this on the normal setting for most of the patients I treat, and that seems to be good. Above there, you will see there is a little slider switch, and it says polarity, and there is a minus symbol, a plus symbol, and a plus minus symbol. So that's going to come into play when you are doing your treatments. So in the world of acupuncture, when acupuncturists stick needles in, they are trying to either bring energy up or bring energy down. So when you're bringing energy up, that's to tonify. So that's the plus setting on here. You're going to use that for things like people who have Bell's palsy, where they have drooping faces, or your energy is really low and you're trying to tonify your kidney energy, which is your adrenals in acupuncture. But most of the time, you're going to use the negative setting on here because most of the things you're going to be treating are conditions of excess. So those are going to be things like muscles that are too tight, headaches, nausea, vomiting, diarrhea, shingles, back pain, neck pain, frozen shoulders, tendinitises. All those things are conditions of excess. So all those are things you want to bring down. As well as anxiety and depression and things like that. So all those are things that need to kind of come down a bit. So you're going to use a negative setting for those. But if you have any questions, the books that come with the devices all have on every single protocol. So let's find a protocol here that we can look at. Here's one for, let's see here, digestive pain and irritable bowel syndrome. And you will see that all of the points marked over here have a plus or minus next to each of the instructions. So it's actually going to tell you what polarity you need to use. So it's pretty well written out for you. But if you have any questions, you can certainly, you guys are going to get a link tomorrow via email that allows you to access our Facebook forum. I do recommend that you sign up for that. It's a great place to ask questions and to network up with other people who are using this device, both therapists and people who buy these for home use. You can ask questions there. People will answer your questions, or you can find other people to practice with or whatever. So do pay attention to that. And while I'm thinking about it, the other thing is tomorrow you're going to get a link, an email link from us that will allow you to watch this video as many times as you want. So if for some reason you miss something, you can go back and watch it again. And in the future, if you happen to want to review stuff, you can certainly come back again and sign up for this tutorial again and catch it again. And maybe I'll be wearing a different colored shirt, and maybe I'll say things a little bit differently that night. All right, so that is all the little features of the Dolphin Neurostim. So now we need to go over how to use this to find treatment points. So like I said, this does have an ohm meter built into it, so it measures the electrical conductivity of your skin. And we know from a scientific standpoint, from the science of this, is that all myofascial trigger points, all motor points, which are the most electrically active points in muscles, and all acupuncture points are all highly conductive to electricity compared to the rest of the skin around it. So if you took an electrician's ohm meter and ran it around your body, you could actually watch the dial, and you'd be able to see some areas that are much more conductive than others. And all of those fall in the category of trigger points, motor points, and acupuncture points. And for the purposes of what we're doing in the protocols, we're just going to refer to them as acupuncture points, but they do fall into a lot of the categories. So let me find a couple of points here to demonstrate for you guys. I'm going to open up the vagus nerve recovery manual here. If you want to follow along, let's see what page we're going to go to here. I'm going to turn to page 12. And if you look on page 12, oh, got it. There we go. We have a point here by the crease of the elbow called large intestine 11. You can see it says LI11. And then you have a point down here called LI4. That's large intestine 4. So in the world of acupuncture, there are a series of what are called meridians, which are considered to be energy lines that run around the body. Now you can see sort of a map of these right here. And each of these lines is named after an organ in the body: lung, pericardium, heart, spleen, liver, kidneys, small intestine, large intestine. Half are male, half are female. The female ones are on the soft parts of your body, the front of your body, the insides of your arms, the insides of your legs and ankles. The male ones are on the hard parts of your body, your back, the outside parts of your leg, and outside of your arms. And each of those points is numbered. So there's a sort of a grid system for where the points are. So if you just look up a basic acupuncture chart, you can learn what each of those stands for. Or if you're just trying to treat a particular disorder, you can just simply look at the instructions in the book and just follow along, because we do have pretty good instructions on how to find these points. All right. So the first point we're going to look at is large intestine 4 right here. And it is in the meaty part right between the finger and the index finger and the thumb. So most people who've never even heard of acupuncture points still know, like, hey, if you have a headache, if you rub between your thumb and your finger, sometimes it helps headaches. So this is a traditional Chinese acupuncture point that is used for anterior face and neck pain. So it's really good for things like tension headaches. It's not so great for migraine headaches. It can cause rebound headaches. So we do recommend some other points for that, but they're actually in the manual. But at this point, it's called Hoku. It's the great eliminator, and it's also known as large intestine 4. So to find that, I'm going to hold my hand like this, and I'm going to squeeze my thumb against my index finger. You can see it makes kind of a little mountain right here. Let's see if I can angle the camera so you can see it. There we go. It makes a little mountain right here. And right at the top of that mountain, in the fleshy part, that's where the acupuncture point is. And you'll know you've got it if you kind of squeeze. So not in the skin part here, but you go up right in here. If you squeeze here, it's actually quite tender. So that's your acupuncture point right there. So I'm going to mark that. I've got a little X right there. And now I'm going to turn the Dolphin Neurostim and find the point for you guys. All right, so I'm going to turn the device on using the roller switch. I'm not going to push this button right now. I'm going to make sure my thumb is on the metal plate. Okay. Now, if you're treating yourself, then this is something you don't have to worry about. But if you're treating someone else, you have to touch this metal plate, and you have to have skin-to-skin contact with the person you're treating. You can't touch their shirt, and it doesn't have to be right where the treatment is going on. So you could put a hand on the back of their neck. They could grab your arm. The electricity has to be able to go into your patient through the tip of this device and cycle back up through your skin and your thumb back into this metal plate. So it's got to make a complete circuit to be able to not only to find points, but also to actively stimulate points. All right, so I'm going to turn the Dolphin Neurostim on. Got a green light, which means my battery is good. And I'm going to do what I told you not to do, just so you can see it. I'm actually going to turn it around and put my fingers on this metal plate so you can watch with me. So as I pull this across the skin, you can hear the tone start to change a little bit. And then when I get right over the point, you'll see that the light goes out. And I can go back to that same point every single time. So this will consistently find treatment points if you put in a little bit of practice. Now, the downside to this is that if you push really, really hard, so I'm going to pick a non-acupuncture point, kind of right here, and I'm going to put it down. You'll notice that not much happens, but if I push really hard, it makes the light go out. So if I push really hard on this, what it does is compress the skin. And when you compress the skin like that, it becomes more conductive. So you can actually get false positives. But if you're using this properly, you're just going to touch this down on the skin and use just kind of regular, just gentle pressure on there. And if you do that, you can reliably find your treatment points. There we go, right there. So you'll be able to go back to those time and time again. And once you've found your points, make sure your thumb is on this metal plate. And then you're going to, with your middle finger, it's the best finger to use, with your middle finger, you're going to hold this button down. And if you were looking at the other side of it, sometimes that light will blink and sometimes it won't. But what you want to hear is you want to hear it beeping. If you hear a steady tone, you're not doing a treatment. If you hear it beeping, you're doing a treatment. So there are exactly 2 times when you want to look at the light on this device. If you look at it any other time, it just gets confusing. When you turn the device on, make sure you got a good battery. And when you're trying to find points, the light should go off over the point. Beyond that, I do not recommend watching the light because sometimes the light will blink when you're doing a treatment. Depending on what polarity it is and how intense you have it turned up, it might blink, it might not. And so there's a lot of room there to go down rabbit holes and think you're onto something. Just trust me. Just look at the light when you turn it on and look at the light when you're finding points. And other than that, forget about looking at the light until you move on to your next point. That is the best advice I can give you. It'll save you a lot of time and a lot of frustration. All right. So the next point we're going to look at is large intestine 11. So I'm going to bring the camera down here a little bit so you can see what I'm looking at here. And I'm going to go to the end of my elbow crease right here. So I've got a crease in my elbow. So I bring my arm up. We're going to go right here at the end of this crease. That's large intestine 11. And this is an acupuncture point that is a homeostatic acupuncture point. It tends to be good for things like fevers. And anytime you need to restore homeostasis to the body, it's a good point. So again, turn the Dolphin Neurostim on using the roller switch here. Put your thumb on the metal plate. Bring it along the edge bring it along that crease. Listen to the tone until you see the light go out like that, and you will notice that I am dead on top of the mark that I made there. So I have some accurate point location going on here. And then I would depress the button and count out about 30 beeps. And if you feel like it's too much, you can use this roller switch this roller dial to turn the stimulation down. Or if you feel like you need more stimulation, you can roll it up and get more stimulation while you're doing it. But you want to count out about 30 beeps, which is going to amount to probably about 15 seconds or so. You can certainly hold it longer than that, but that's kind of the minimum of what you would want to do. So that's kind of a basic guide to finding points. Again, I do recommend that you do a little practice before you start going out and treating patients. What I notice after teaching thousands and thousands of people in live workshops is that it does take a couple of days to learn how to accurately use the point finder on here. But after a 2-day workshop, I'm pretty confident that most of the people in my workshops can accurately locate points. So really, it's just a matter of sitting down and playing with it a little bit. If you are a therapist, the best advice I can give you is don't sit around and say, hey, I want to wait until I'm comfortable with this before I go use it on patients. You're never going to use it. You'll put it on a shelf. You'll forget about it. I had people show up at workshops who bought devices 2 or 3 years ago, and they show up for me to teach them how to use it. And these are sometimes people who've taken workshops who wanted to be more comfortable with it. So I do recommend that you just go ahead and use it. There's really not much harm you can do to people unless you do something stupid like stick this in somebody's eye. Other than that, you're generally either going to get outcomes or you're not. There are a few contraindications, which I'll go over in a few minutes. Okay, so that's the basics of how to locate treatment points with this. The next thing I want to talk about with you guys is how to do vagus nerve stimulation, why you would want to do vagus nerve stimulation, and how to set all that up. So what is the vagus nerve? Well, the vagus nerve is the longest nerve in the body. It kind of starts on either side. The easiest access point is kind of behind the ear. It goes and comes together right here and goes all the way down into your abdomen. It's known as a wandering nerve. And it has a very strong influence over the sympathetic and parasympathetic nervous system balance in your body. The sympathetic nervous system is your fight or flight response. The parasympathetic nervous system is your rest and digest functions. And that's where recovery happens. So if you are sick or injured or trying to keep yourself well and trying to recover from workouts or get over a surgery or generally stay healthy, vagus nerve stimulation is a really good tool to use. And it also does a really nice job of reducing systemic inflammatory responses from things like toxic mold exposure, spike proteins from COVID or COVID vaccines. Autoimmune disorders tend to be very inflammatory. So I know a lot of people personally who use this who have autoimmune disorders, and it does a good job of moderating that down some. It's not going to cure your problem, but if you are able to stop the number of flare-ups, it buys you a lot more time to adjust your diet and supplements and do the things you need to do to get better. So it's a nice tool for that as well. It's also quite useful in concussion treatment, brain injury treatments. It's good. It works well for anxiety and depression, attention deficit disorder. There are a lot of things that vagus nerve stimulation seems to have a very strong influence over, because if you get into the research, the vagus nerve affects almost all of those, even down to things like Parkinson's disease. So I really would strongly advise, if you have a vagus nerve stimulation kit, use it. I use my kit usually about twice a week for about 30 minutes at a time. And I find it's a good way to kind of keep my system toned so I can make it through the week. So like, how often should you use it? Well, let's see. I'm 53 years old. I raised 2 kids by myself. My kids are both active in school activities. I work from 8 in the morning till 6 at night. So I do about 10 hours of treatment. And then when I get off work, there's all the things my kids need to do. And I have to cook dinner and make sure homework's done. And then I travel a fair amount and I teach and I lecture at conferences. So I'm pretty busy. And I'm not 20 anymore. So I find that if I do vagus nerve stimulation a couple of times a week, it keeps me from gassing out about halfway through the week. Otherwise, I start to get really, really tired. Feel like I need to get naps whenever I get an opportunity. But if I kind of do 2, sometimes 3 vagus nerve stimulation treatments in a week. That seems to be good for me. Now, if you have something that's much more acute, for example, when I had COVID, I was using vagus nerve stimulation when I got really, really sick. My oxygen saturation actually dropped from 91 or so down to about 80. And over the course of a couple of hours, I was able to bring it from 80 back up into the very low 90s. And that actually cut me out of the hospital. So there are certainly times when you would use it a lot more than the recommended 30 minutes. But most of the time, you're not going to use it quite that much. If you're an elite athlete, you might find this very useful immediately after your workouts. It helps stave off delayed onset muscle soreness and can keep you out of overtraining syndrome. Now, like my son, who is 12 years old, has just broken his arm wrestling. He went the entire wrestling season last year with a broken finger, and every time we turned around, it would start to get better. Then he would break it again. Anyway, he's all healed up from that. First wrestling tournament of the year comes up, wins his first match, comes to the second match, he breaks his arm. So we are using vagus nerve stimulation to speed up the recovery from the broken arm. So my expectation is that his arm will be healed considerably faster than people who don't have access to this. And we're using this device to treat around the area of the break. So when you use microcurrent like this, and it can't be just any old e-stim, it's got to be low frequency direct current at about between 1 and 3 hertz at a 50% duty cycle, between 80 and 800 microamps ish. In that range, it will increase ATP production by 400 or 500%, which is healing factors. So it actually speeds up healing. It increases protein synthesis and cellular membrane transport. So if you use this on an area of a broken bone or a bruise or whatever, expect it to heal up much faster. And there are particular acupuncture points for bone. So there are acupuncture points for blood, bone. There's ones for different types of tissue in the body. So we're also stimulating the acupuncture points for bones. My expectation is he's going to heal up much faster than a lot of other people normally would. All right. So if you're going to do vagus nerve stimulation, a basic setup you're going to need your vagus nerve stimulator. You are going to need your, in your kit is a black cable that looks like this. It has a male connector on one end. Let's see if I can hold this so you can see it. And male connector on one end, and then a cup on the other end that has a little metal plate in there. So I'm going to take this, I'm going to put it over the end of the Dolphin Neurostim. This tip has to touch on that plate. So you want to make sure that you firmly put it on here. Don't mash it super hard, but put it on there firmly. Okay, so I've got this connected. Then you want to pull out one of these little oval electrodes. These are one of the more expensive electrodes you can get because we have to have these specially cut. So my recommendation is, if you're going to be using those electrodes, get some alcohol, get a paper towel, and clean off the metal plate of this Dolphin Neurostim. You want to make sure there's no oil from your fingers on there. Because if there is, and you put that Dolphin Neurostim pad on there, what's going to happen is that oil is going to get on there and it's going to mess with the adhesive, and you're not going to be able to use it for very long. One of these for me, because I always keep myself pretty clean, one of these for me, when I put it on, I will get a month or a month and a half of treatment, even just taking it on and off, because I don't always have these on here because I'm using them for different things. But as long as I clean this and put it on there, I get a lot of time out of these. If you don't, you're going to find that you spend a lot more time buying electrodes for your device. All right. So I've got this electrode on here. There is a white cable in your kit that looks like this. And you'll see that there is a male connector on one end, and it looks like a female connector on the other end. But if you look in there, you'll see that it is a shrouded male connector. Okay. So both of these ends are exactly the same. Just some hospitals require us to have that shroud over there. So we're going to connect. I would pick this end to go on the end of the Dolphin Neurostim, so that the shrouded end that's going near patients, there's no way you're going to poke your patient. So there are two things left to connect here. One is one of these triangular pads, and there is an actual guide that you get that comes with your kit that shows you the different locations on where you can put these pads, and also the ear clips. So that is in your kit if you want to take a look at that at some point. My recommendation with these, again, you want to take some alcohol and put it on a pad. So you can go buy these little face scrubber pads, little cotton face scrubber pads, and put them in a glass jar, like a mason jar, and just pour alcohol over them. And that works great. So wherever you're going to put this, you want to clean that area to get the oil off. So the two locations recommended for this are either on your wrist or on your stomach below your belly button. So if you put it below your belly button, the electricity is going to course through the entire length of the vagus nerve. But there are some times when you might want to put it on the wrist because there are a lot of parasympathetic calming points on the wrist that are used for anxiety and other things like that. So I'm just going to demonstrate it with it on my wrist here. And I'm going to connect up this white connector. Make sure my skin is dry. Peel this off. And I either want to put it straight up and down like this or across my wrist like this, whichever one floats your boat. But it covers 3 acupuncture points there, which are known as the golden triangle in acupuncture, and they influence things like blood pressure, anxiety, depression, stuff like that. And then you need an ear clip. And with your kit, there are a couple of basic kinds of ear clips depending on when you got your kit. So you will probably have a couple of ear clips that have a metal plate on them in here. These are really good. I do recommend that you moisten them with something because they tend to, electricity tends to want to run through one little area there and can cause some irritation. But if you wet them with an alcohol gel or something like that, it works a little bit better. So then there are some ones that have conductive rubber on them, like a conductive silicone tip on them. These you absolutely have to have a conductive medium on them. Again, you can use ultrasound gel, alcohol, water with a slight bit of salt in it. Sometimes I use EEG paste. This particular paste is called 1020, but there's other stuff available. And I just keep it in the office because it's easy for me to use. And then the most recent ear clips to come out, which you may not have depending on when you bought your equipment, are these dome clips. And you can see that there is there we go. You can see that there is a much thicker pad on here than there is on this one. So what this allows you to do is to access certain parts of the ear. There was a recent study that came out looking at the concentration of nerve endings near the ear for the vagus nerve. And there was an MRI study. And what they found is that there were 2 locations that really seemed to be the best. And one was on the inside of the tragus. So on your ear, you have this little flappy thing over your ear hole. So if you kind of push on it, it clogs your ear. So this is called the tragus right here. So on the inside of that, so if you were using an ear clip, you would put the pad side of it with some conductive medium on it so that it went inside the tragus right there. The problem is, for most people, that pulls loose pretty easily. This is the highest concentration of nerve endings for the vagus nerve. So it is the ideal location, but not everybody's tragus is the same size. Some are thicker, some are thinner, some are too short. So if it doesn't stick there, there is another location that's better. So we designed these specifically to get to that other location. This works on just about everybody. So this is a little flappy thing in your ear called the tragus. If you move across from there and up into here, this is called the upper concha of the ear. So in the upper concha, that's the second highest concentration of nerve endings for the vagus nerve. So you again would want to moisten the little pad on here, and you're going to put this up in there so you can see the dome. You're going to put it up in there. So this is designed so that once it touches down, it actually squeezes in enough and picks up the skin in there. So this is probably the most secure location. But you can, as a backup, you can use the earlobe. The concentration of nerves down there for the vagus nerve are not nearly as high, but it does work. So if you're in a pinch, use the earlobe. But if you happen to be able to get it up in here, that's even better. All right, so we're going to connect this up to our little metal plate. I'm going to take a little bit of, let's just use a little bit of alcohol here because that's a little more accessible to most people. So I'm just going to get a little bit of alcohol on my finger, and I'm going to just moisten this a little bit. And I'm going to put it on the upper concha of my ear, right up in here, kind of across from the tragus and up in there. So once that's in there, I'm going to turn the Dolphin Neurostim on. And it's essentially has found an acupuncture point because it's in these conductive. There are tons of acupuncture points all over your ear. So if you do this, you're going to hit an acupuncture point. So what I should hear is a really high pitch, which I do, just like when I'm finding acupuncture points. And the light should generally go out. If you turn it on and you have a steady green light like that, and you think you have everything connected up, you don't. Something's wrong. Either this isn't pushed on, one of these isn't connected properly, you don't have it in the right area of your ear. You know, you're doing something. You don't have a conductive medium on the rubber there. You're doing something because the light should go out and you should get a high pitch. If you don't get that, play with it a little bit until you get it right.
So can you just hold, can you just like go through the whole connection from beginning to end of what's connected to what right now?
Sure.
Like black to white to,
Yep.
I lost track of what you connected to
All
what
right.
to get.
Black cable goes to the tip of the unit. We go there. The black cable goes to the tip of the unit because it has a cup on it. This can only go in one place, which is on the tip of the unit. The oval electrodes go on the metal plate, which connects to the white cable. Again, these will only connect to electrodes. And then you've got the white cable running either to your wrist, or you can put it 4 fingers below your belly button. And the black cable runs to an ear clip, which is going to go in the upper concha of the ear or inside the tragus or on your earlobe. And if it seems a little confusing, you're going to get a link tomorrow and you can come back and watch this as many times as you want. So you'll be able to look at it again. All right, so I'm going to turn it on. Then I'm going to push this little black button right here, and the device should go silent. Depending on how intense I have it, the light might blink, but you can see, so I have it on the highest setting, you can see the light is blinking, but if I roll it back, it stops blinking. So that's why I tell you guys, like, don't pay attention to the light once you've found points. Like, don't look at that light to see if it's flashing or not. It's just going to confuse you. So now I can put this down. I can read a book. I can wash dishes. I can do whatever. And at the end of the cycle, it's going to revert back to this high pitch. And that's going to be anywhere from 11 to about 14 minutes. It measures the number of electrodes going to the tip. So when it hits a certain number, it resets. So at that point, I can push this button and do the cycle again if I want to. Now, how often should I use vagus nerve stimulator? Not how often, but how much time should I use it? So the first time you do this, we use these in our clinic, and we do send these home with patients. So the first time that we hook a patient up, we do a 5-minute treatment. Not everybody's vagus nerve is the same. Not everybody has the same pathology. You may be hypersensitive because you have tick-borne illnesses and fibromyalgia and all kinds of stuff like that, and have a really sensitive system. Or you may be like a high-level athlete who goes through a fair amount of discomfort on a regular basis and be pretty robust. So depending on where your system is, it's going to have a slightly different effect. You may find that a 5-minute treatment just calms things down, and 5 minutes is all you need. You may find that 5 minutes makes you a little fatigued. And if that's the case, that's about that's about as much as you need. But on the other hand, you might find that 5 minutes, you don't really feel a difference. So we recommend you add 5 minutes a day until you hit anywhere from 20 to 30 minutes, which should be your treatments. Again, in more acute situations, you might go as long as an hour or 2 on your treatments. I know friends of mine who have had some autoimmune problems and some mold problems have used these devices for hours at a time, but that is after they built up a little bit. Now, there is another way you can connect this device. So in your vagus nerve kit is a thing called a splitter, a Y wire. It looks like this. You guys see this? So it has 2 male connectors on one end and a female connector on the other. So I have everything hooked up here. So the only thing I'm going to do is I'm going to disconnect this ear clip. So I'm going to pull the ear clip off. I'm going to put the Y wire, the splitter, on. Okay. So now it's connected to the black wire. So black wire goes to black wire. Then I'm going to connect the ear clip to one of these male connectors. Now I have another one that doesn't have anything on it. So I'm going to put another ear clip on there. And now I can go to both ears at the same time. Now, you obviously have a vagus nerve on either side. So this is a way to stimulate both sides of the vagus nerve. If you're going to do that, so before we were using the negative setting for the left ear. If you're going to use this biphasic setting, this plus minus setting on here, you're going to do both ears. So if you do both ears, you're going to go to the polarity switch and slide it over to the plus minus symbol, which is the biphasic setting. And that's going to bounce the electricity kind of back and forth between the two. And we do recommend, if you have it on both ears, that the electrode, the grounding electrode, if you want to call it that, goes below your belly button. Okay. And that works pretty well for most people, but for some people, we've seen that can actually make them a little bit nauseous. So some people don't respond as well to two of these. It's rare, but we have seen it. Like I said, everybody's vagus nerve is a little bit different, which is why we have different ways to hook this up. Okay. So there is one other way you can hook this up. You can choose to do a treatment on the right ear. Now, the left ear tends to bring things down pretty well, and the right ear tends to bring things up a little more. So if you did a vagus nerve stimulation treatment and you found that it made you really feel kind of fatigued and you didn't need to be tired right then, you could switch. If you were using just one of these, you could switch the electrode over to the right ear. Okay. And then you could put this, and you could go anywhere in the ear, in the tragus or on the earlobe or in the upper conch of the ear, any of this, and you could put it on the positive setting right there. Okay. And if you put it on the positive setting, it's going to bring your system up a bit. Now, we do recommend only doing that for about 5 minutes or so, and do not do that before bedtime, because it will ramp your system up a little bit, and you will find sometimes it will be hard to go to sleep. So I have some friends who use this for their problems, and what they find is at nighttime, in the evenings, they use the Dolphin Neurostim on their left ear. Okay, so they have put it on their left ear, and they put it on the negative setting for about 30 minutes or so before they go to bed. When they wake up in the morning before they go to work, they'll put it on their right ear for 5 minutes on the positive setting. Okay, but not more than about 5 minutes or so. So that helps kind of get them pepped up a little bit in the morning. So that's a basic setup for the vagus nerve stimulation. There's a whole entire book that comes with the device, and you can certainly spend some time cruising through that book. And there's a lot of information in here about the science of treating the vagus nerve, what it does for your cortisol levels. So treating the vagus nerve will actually modulate your nervous system. This will drop your cortisol levels. This will increase your heart rate variability, HRV. You might want to look that up. Just Google HRV, heart rate variability, and there's thousands and thousands of studies on heart rate variability. The military tracks it. They track it when in racehorses. They track it in elite athletes. It is a measure of longevity, and it is a measure of how well your system can both respond to incoming stressors as well as recover from those. So the higher your heart rate variability is, even sleep number beds will track heart rate variability, and the Aura rings that people wear, those will do it as well. But the higher the number is on your heart rate variability, which is not your heart rate, okay, it's a time variance between beats. The higher that variability is, the healthier you are, and generally the longer you're going to live. When that number drops, that's one of the numbers they look at when they do stress tests in the hospital on people. So if they do a stress test on somebody and they stress their system and their heart rate variability doesn't shift, that tells them that the patient is already maxed out. And if you add any more stress, for example, putting somebody under anesthesia, they might not wake back up. So that's part of why you do a stress test on people, to see how their system is reacting, to see if it can deal with incoming stressors. And stress can take a lot of forms. That can be somebody yelling at you. That can be physical stress from the job you do. That can be terrible food that you eat. That can be something going on in your system like cancer or some autoimmune thing. All of those affect your heart rate variability. So if you use this regularly, you can actually make changes in your heart rate variability that makes your system more robust. The other thing is it will also influence something called your high frequency vagal tone. So your high frequency vagal tone is a measure of the parasympathetic nervous system. So the sympathetic nervous system is your fight or flight response, which is represented by the white side of the yin and yang symbol. Okay, so the yang, the male part of the yang symbol, is your fight or flight response and your ability to fight back. The yin side, which is the darker side, is the female side, and that's nurturing, recovery, what they call rest and digest. You have to spend about 70% of your day on the parasympathetic side of your nervous system. And if you don't, you're kind of screwed. So the longer you spend time not 70% of your day in the parasympathetic side of the nervous system, the worse your system gets. So if you use this to modulate your nervous system, you can make sure you're spending enough time on the rest and digest side so that you can then recover. And when you're ill, those numbers get kind of skewed anyway. So it's a really good tool for modulating those things. And again, things like concussions and strokes and things like that, it's a really nice recovery tool. I spent, probably 15 years of my career working for neurologists and neurosurgeons. And we use this a lot in recovery for in those cases. So there are stroke protocols, there are protocols for people who have had concussions and stuff like that involve treating acupuncture points with the tip of the Dolphin Neurostim, and then using the vagus nerve stimulation. So very, very powerful tool. It's really kind of interesting how effective it can be. And so the next thing we're going to talk about is how to do a basic scar release. So one of my favorite workshops to teach is our scar workshops. And it's a whole 2-day workshop for physical therapists and massage therapists and occupational therapists and doctors and nurses and stuff on how to treat scars. And there is nothing out there that I have seen that addresses scars as well as this device does. That includes manual therapy, that includes ultrasound, that includes laser, that includes light therapy, that includes gua sha, scraping tools, injections, needles with electricity running through them. None of it works as well as low frequency direct current. Releasing scars is an electrochemical thing. So what you have is tissue that is electrically depolarized. It's got the wrong polarity. Normal body tissue has a negative charge. Scars have a positive charge. If you can change the electrical charge of the scar tissue, then it will relax. It actually becomes less dense. So we've done studies looking at diagnostic ultrasound, and the measure is called the cicatrix or cicatrix, however you want to pronounce it, gray mean density. And what we know is properly done, if you use a Dolphin Neurostim, you can get about a 20% reduction in the overall density of a scar with one treatment, and it's permanent. When you reduce the density of the scars become more pliable. So when would you want to use it? Well, the question is, when wouldn't you want to use it? You know, have you had a C-section? Have you had a hysterectomy? Have you had your gallbladder out? Appendix, mastectomy, open heart surgery? Have you had a knee replacement, shoulder replacement, ankle surgery? Have you had broken bones in the past? That's a scar. Have you had a chronically sprained ankle? There's scar tissue there. All of those are cases where you're going to end up needing to treat with microcurrent to release the scars. Because the numbers are this: if you have surgery anywhere in here, abdominal surgeries, one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. So that's scar tissue that goes beyond the boundaries of the incision. It wraps around your organs, it pulls on the connective tissue. It's a big contributor in neck and back pain. I used to do 1 day a week in women's health. I treated tons of C-section and hysterectomy scars, and I cannot tell you how many people I've seen over the years who have chronic neck and back pain because of the amount of pull exerted by that scar. And if you can release that and take the pressure off, the relief can sometimes be instantaneous. So it is pretty interesting how effective it can be. Scars can be painful. So that's one of the reasons we treat scars, because scars can wrap around the nerve endings that go up to the skin. Scars can cause numbness. Scars can look ugly. They can get all raised up and bubbly, or they can kind of sink down under the skin. You can change that with microcurrent. Scars can pull on connective tissue. For example, get somebody who has had like a hip replacement and they can't raise their shoulder. They have a frozen shoulder, but it's not really a shoulder problem. The problem is it's almost like somebody pulling down on your shirt and then you can't raise your arm. My problem isn't here. My problem is down here. So your entire body is covered with sheets of connective tissue called fascia that wrap all around your body. And if you go putting cuts through that, it pulls on that entire network. It's like wearing a bodysuit. So if you pull on that network, it'll restrict range of motion in all kinds of ways. And it actually influences the movement of lymph through your body, because lymph moves between the fascia and the muscle. So if you put cuts across it, all the lymph in your body has to come back up, come to basically up to the right around the right shoulder to get dumped back in your body. So if you have scars of any kind, and I don't care if you have the most perfect plastic surgeon in the world who's put little tiny nicks behind, all of those scars count. Doesn't matter how the scar looks. It matters what the scar does. Then it doesn't have to hurt to cause problems. I've seen little tiny scars from childhood injuries on people's shins cause significant amounts of hip pain, and scars that are near acupuncture points can actually aggravate symptoms. It's kind of like there are some piercings you can put in your ear for migraine headaches that doctors do. They can be quite effective. But if you go put that piercing in the wrong place, it's A, not going to help your migraine headaches, and B, can actually contribute to some health problems because the entire body is represented in the ear. So you got to be careful with this stuff. So if you have little tiny scars around your body that are over particular acupuncture points, those can actually cause you to have health problems later on in your life. They'll affect shoulders and things like that. I've seen all kind of crazy things over the years. So anyway, how do we go about treating a scar? Like, how do you inactivate the scar tissue? The cool thing is it's actually pretty easy. I can get really advanced with this and throw in all kinds of acupuncture points and stuff like that. But I'm going to show you guys a basic scar release that you can use on just about anybody. So I've got my little board here. I'm going to turn you guys so you can see it. And we're going to draw a little stick figure here. And our little person here has had, we're going to pretend like this person has had open heart surgery. Put the pelvis here and some legs down here. So this person, who is very unhappy, has had open heart surgery. So we're going to put a scar right here that represents our open heart surgery scar. And by the way, people who have had open heart surgery tend to have a lot of upper back pain in here, which can be almost instantly relieved by treating a scar. So what we need to do is repolarize this scar tissue in here. Well, how do we go about doing that? Well, if we try to take pads like this, like you would get even with like a normal TENS unit, and put it over the scar, the problem you run into is that scars are electrically not conductive. So normal skin's at least some conductive, but scars are very non-conductive. So what we need to do is restore the capacitance of this tissue to conduct electrons. So how do we do that? Well, you can't do it with pads. You got to have not one, but two Dolphin Neurostims. So we basically have to be able to bounce electrons back and forth between these. We have to play ping pong with electrons is a good way of thinking about it. Now, your settings are going to be putting one Dolphin Neurostim on the negative setting and putting the other on the biphasic setting right here. So these are your two settings, negative and biphasic. And you're going to take these devices, you're going to go on either side of the scar. So I'm going to grab a couple markers here. So we're going to go, doesn't matter which is on which side. We're going to go negative on one side. And we're going to go biphasic on the other. We've got a little plus minus symbol right there. And we're going to start on either side of the scar. Now, you want to start not on the scar tissue itself, but just off the border of the scar. And we're going to put these down. And we're not looking for acupuncture points. So when you turn it on, when you set it down on the skin, the light doesn't have to go off. So don't try and make the light go off because it may not go off. But you're still going to get some electrons through there. And you're going to hold it down there and you're going to push the button. You're going to hold it for 10 beeps. So count out 10 beeps, then move 1/4 of an inch and go down and count 10 beeps. So you're going to go all the way down the scar like that. And once you get to the bottom of the scar, you're going to work your way back up. Now, what I will do sometimes is change the Dolphin Neurostims in my hand so the polarities are changed. I'm going to work back up through this exact same area where it was before. Again, hitting all those points about 1/4 of an inch increments, counting 10 beeps. So I went down, then I went back up, then I'm going to go back down one more time. So that's 3 sweeps, okay, all the way down. And so now I've got down, up, and down. Now you could have started at the bottom and worked your way up and back down. It doesn't really matter. But the bottom line is you want to sweep up and down the scar. So what we're doing is we are playing ping pong with electrons through the scar tissue. We're pushing from one side and we're pulling to the other. And when we do that, we are changing the polarity of this tissue and making it more conductive. Now, once I've done that, 3 sweeps, 10 beeps on each point, I'm going to start at either end of the scar. Again, push the buttons down, count 10 beeps, push the buttons down, continue, and work in 1/4 of an inch increments and just work up and down through the scar 3 more times, but actually on the scar tissue itself. And once you've done that, that's a basic scar release. So what can you expect when you do that? My expectation is when I treat a scar on somebody, and I run a specialized program, I market myself to plastic surgeons and other surgeons because they can't really control how much a scar hurts. It can be a beautiful incision and heal beautifully and still be a painful scar. So I market myself to surgeons and say, hey, if you have patients who have painful scars, send them to me and I'll take care of it. My expectation is the first time I treat a scar, that scar should feel 50% better. So if it's a painful scar, it's going to feel 50% less painful or better. I'm hoping for 80 or 100%, but 50% I'm happy with. So if we figure we get about a 20% reduction in the overall density of the scar with each treatment, you figure about 5 treatments completely release a scar. And hey, look, let's say that you're somebody who does scar injection like neural therapy using procaine or something like that. So let's say you're an injector and you inject scars, which does work, but it only works where you can inject the procaine into the scar tissue itself. And let's say you have deep abdominal adhesions. Let's say you've got like a hysterectomy scar or C-section scar across here. Well, you can't stick long needles down into all the adhesions near the intestines and stuff like that because you can't poke holes in there. But with these, you're playing with electrons. So you can actually use these to release these kinds of scars. And, you know, there's basically no risk in doing it. It's either going to work or it's not going to work. And I have never seen this not have some effect on a scar. Some scars are a little harder than others to deal with, but most of them respond really well. If the scar's dented in, they generally tend to pop out. If the scars are raised up and red and purple and ugly, they tend to flatten out and have more normal color. So it's a very, very effective treatment, and it's fast. Like I almost expect it to work. So it's one of the things I love to do because I know it's going to work just about every single time. So I love teaching that course. It's a fun course. If you guys get a chance to come out and do one in person, we do teach those around. We're mostly done with our workshop schedule for the year. I think we have one basic workshop left in San Antonio, Texas, I think. And that's the very last one for the year. But we do offer them throughout the year. And I think we have some online courses as well. So we have an online scar course that you guys can log into and if you want to learn more about it. Okay. So that's the basics of a scar. Well, hey, what if the scar is not aligned? What if it's round like a burn scar? And where I live down here in Georgia, we have a lot of paper mills. And so we tend to get a lot of people with steam burns. So what happens when you have a round scar like this? Well, you're going to take your Dolphin Neurostims. You're going to put, again, one on the negative setting, one on the biphasic setting, and you're going to work around this scar. You're just going to keep the units on opposite sides of the scar and work around the scar like a clock. And again, what we're doing is we're just bouncing electrons back and forth through this tissue. And the more electrons we pass through there, the looser it's going to get. Now, a scar like this, like a steam burn, is going to take a lot longer than a linear scar like this because it's more surface area that you have to cover. But I can tell you from past experience, it is also quite effective for this. How soon after surgery can you do this? Immediately. If you do this immediately after surgery, what you will find is that A, it heals a lot faster, and B, it cuts down on the overall amount of scar tissue that actually forms. So we got a lot of physical therapists who use this for total knee replacements, for shoulder surgeries, hip replacements, things like that. And the sooner they start, the more functional the patients become faster. Usually with knee replacements, there's always a few degrees of range of motion that people have a hard time getting back, which is often attributed to scar tissue. And you can bypass that many times just by using this device and doing that. So very effective. It does work for scars in your head and anywhere else. Remember, you do have to have skin-to-skin contact, but if you need to, you can actually take this white cable that we were using earlier. Let me pull this thing out. You can take this white cable and you can put it on here. Remember, you want to clean this really well. And you can put this anywhere on the patient. It doesn't really matter. And as long as you do that, and then touch this, when you work on your patient, it conducts electricity back and forth. There is also there is one more little tool that you guys might be interested in. There is something you can buy. It's called a wrist strap. One of these goes on me. One of these goes on my patient. Typically their wrist, but you could put it on their ankle if you wanted to. We made some really super long ones that you put actually under a horse's tail. So it fits under the root of the horse's tail so that people can do treatments on horses because they have a lot of fur and it's hard to dig your fingers in. So if you're using these, then you're electrically connected to whoever. So then all you have to do is touch the metal plates on here, but you don't have to have skin-to-skin contact with your patient. Now, you can't treat over clothing with this, but you can treat through clothing. So this needs to go through the actual clothing itself. So you have to work it around so the tip touches the skin. If you don't do that, you're not going to get a good treatment. All right. So that's the basics of how to do a scar. Let me run over some contraindications really quick with you guys, and then we'll take a little bit of time here and give you guys an opportunity to ask some questions. So what are the things you do want to do and don't want to do with this? The rules are pretty simple. I like to use what's called the rule of pencils, and that is don't stick this anywhere you wouldn't stick a pencil. Don't stick it way deep in your ear. Don't jam it up your nose. Don't put it in your eye. Don't jam it down your throat. As long as you don't do those things, you're probably in a pretty good place. If you have somebody who has a history of epilepsy or seizures, do not treat directly on top of their head. However, there are acupuncture points that do stop seizures. I have used them and they will stop a seizure. They're just not on top of your head. So you can look those up if you know somebody who's got epilepsy and you want to stop it. If you're going to use these on small children, use it on the lowest setting. We have taught workshops for All Children's Hospital down in Tampa. They've used these devices on small children. They work fine. Just turn it down a little bit. It's fine to use on pets. I've treated dogs. I've treated horses. I've treated cats. Cats have to be pretty sick before they let you treat them or they might hurt you. But it is quite effective. I had one of my cats who had severe kidney problems. I kept her alive for probably 1.5 years longer than she should have lived just by using this device. So very, very effective in modulating internal organ dysfunction. Because this is classified as an eStim/TENS device, you shouldn't treat over active cancerous tumors. That's considered to be a precaution. So I would check with a doctor first to see if it's okay. On pregnant women, I would not use this unless the doctor tells you it's okay. Doctors will prescribe TENS units for women who are pregnant all the time for sciatica and stuff like that. The rules are don't treat over a gravid uterus. So if somebody's pregnant, don't treat over their tummy. What they typically do is say it's fine to treat over the back. The specific acupuncture points you want to avoid if somebody is pregnant, don't treat on top of the head. This pushes energy down. You don't want to push the baby out. Don't treat on top of the shoulders because these points push energy down, which can force the baby out. Don't treat large intestine 4, the great eliminator, because it is the great eliminator. And avoid points on the inside of the ankles because these points are specifically used for bringing on labor. And I have used them to do that when I worked in women's health, but I don't currently work in women's health. So if I treat somebody who's pregnant, it is specifically because their doctor told me to do so. Now, if you're buying these for yourselves, you can do whatever you want, but I'm just telling you as a practitioner. Other things, plates, screws, joint replacements, staples, all those kinds of things, those are fine. Not a problem with any of those. Dorsal column spine stimulators, baclofen pumps, insulin pumps, all those are fine. Pacemakers and defibrillators, if I would check with a doctor. There's a little insert that comes with your Dolphin Neurostim device. If you open it, it's generally under the flap of the little case it comes with. It's got all the electrical parameters. If you want to use on somebody who has a pacemaker, send that to the doctor and say yes or no. If they say no, don't do it. So those are your general contraindications. I don't think there's anything else. I think that pretty well covers all the bases. So let me look in our chat section here and see what kind of questions we might have from you guys. All right. Ooh, got a few messages on here. Let's see what we got. Is it possible for the stim to bring healing? Yes, it is. It increases ATP production 400 to 500%, which is about along the lines of what a really good laser, like a $70,000 laser, will get you. I have used these on friends of mine. I do not do wound care, but I've had friends of mine who've been through wound care for non-healing diabetic ulcers. I have used these after they went through wound care and that didn't work. I have used these on non-healing diabetic ulcers and gotten tissue granulation and saved a couple of toes in my friends. So it worked pretty well then. For vagus nerve stimulation, if you put it on the abdomen, we always, if insensate on abdomen, we always use the wrist. Yeah, you can definitely use the wrist, not a problem. Except if you're using positive stimulation, we do recommend that you do the abdomen. You can try it on the right wrist if you want. If you do left side, do left wrist. If you do right side, use your tummy, but you could use the right wrist if you needed to. Let's see what else we got down here. If the scar is a hip to hip across the abdomen, say 25 to 30 inches in curve, do you still do end to end 3 times or do you break it into smaller segments? Okay, so that's a good question. So what you would want to do is whatever time you have. So if you have an hour to play with, then you can do the whole thing. Whatever progress you make with a scar is permanent, so it doesn't change. So if you release a portion of a scar by 20% or 50%, you can go back a week later or a day later and continue to work on the rest of the scar, and that's fine. So any changes you make in a scar are going to be permanent unless you re-injure the tissue in some way. So that's not really a problem. So it really just depends on how much time you have. But I would say if you have the time, certainly spend it treating the scar. Do you do scar treatments daily for multiple treatments? You could. But also remember that when you treat a scar, so what we found out in the past in doing studies is that the scars tend to electrically continue changing for 24 to 48 hours after we do a treatment. So it wouldn't be wrong to go back and treat a scar again if it's on you. Sure, that's fine. But do remember that you're going to have a scar that is better released generally out after 24 or 48 hours than when you just did it. So you actually expect that to continue to change as the polarity of the tissue changes. Let's see what else we got here. What about metal pins? Not a problem with metal pins. Use it to your heart's content. Vagus nerve stimulation. Have I seen that help people with insomnia? If so, is bedtime okay? Yes. Actually, I was having, with the time change, I was waking up at 3 o'clock in the morning. It was driving me crazy. So I started doing vagus nerve stimulation nightly, and I was sleeping through the night. So yeah, it really does help with insomnia, assuming, of course, there aren't other factors at play. Like your cat's running across your bed at 4 o'clock in the morning or something like that. Because I happen to have 2 cats. So my dog and my cat died about 1.5 years ago, and my kids wanted more pets, and we couldn't get a dog because we're just never home. So we got my babysitter that keeps my kids when I'm out of town teaching is a physical therapist, but she also works for the local no-kill shelter fostering kittens. So as you can imagine, we ended up with 2 free cats that are now about 1.5 years old. And, anywhere from 1 to about 4 o'clock in the morning is when they like to run around the house and wake us all up. So I'm considering how I might be able to use vagus nerve stimulation on them and not on us. But they're going to do their own little thing. All right. Let's see what else we got here. Would you use it on a partial tear where the scar is supporting the tendon attachment, or will it make the scar less stable? It's not going to make the scar less stable. If you have a partial tear, it may actually help heal it a little bit. It's just going to give you more pliability in the scar. That's all. It's not going to make the scar floppy or anything like that. It's just going to make it, it's going to actually make the tissue more functional is basically what's going to happen. I have seen some cases where, like we had somebody in a workshop who had their foot almost completely amputated. She was a physical therapist, and she was a kid when it happened. She was lucky that they saved her foot, and the doctor told her she'd never walk again. Of course, that pissed her off, and she learned how to walk again just to show him, she could walk again. I think doctors do that on purpose. But anyway, so she became a physical therapist. But she always had problems with his ankle. And we were actually in a scar workshop, and they did an entire scar release around that scar. And for about 30 minutes after they released it, her foot was floppy because for years the scar had been doing all the work and her muscles weren't activating the way they should. And then once we treated with the acupuncture points to activate the muscles, it was fine. But I'm quite sure there was some things in there that were still partly torn, but no, she was fine. If someone is being treated for prostate cancer, it can't be used on a wrist injury or knee injury. So by classification, by FDA classification, this is a TIMS device, and there are precautions and contraindications when you're dealing with cancer. So you should get the doctor's okay first. So, that's, now for my own family members, have I used this on them when they have cancer? Oh, absolutely. But you do have to keep in mind what the FDA cautions and precautions about things. So, I'll leave that up to you. So you're certainly not treating over the area of cancer, but I would still, take precautions. Okay, so that looks like all the typed out questions. So I'd kind of like to open up the floor here for you guys to ask questions in person. So if you need to unmute your microphone or whether to ask questions, please do so and let me know what questions you guys have, because we do have a little bit of time here. So what can I help you with?
I have the question. I don't know that you caught it, but really I was asking, the issue is with people who don't have sensation. Like if there's no sensation on the abdomen, do you still recommend putting the pad on the abdomen or still doing the stim on the abdomen? Like even though they're completely insensate there's no issue with.
Yeah, that's not a problem at all. It's still going to conduct electricity the way it needs to. I can tell you that I have worked on people in the past who had their spinal cords were severed and they were in wheelchairs and had zero sensation or movement down in their feet. And I can still treat acupuncture points in their feet to affect things like their shoulders. And it's quite effective. acupuncture points. So in the world of acupuncture, the points tend to run through the fascia, not through the nerves. Um, and in the case of doing vagus nerve stimulation, you're simply trying to complete the circuit. So it doesn't matter if you can't feel anything, your body's still going to conduct electricity. So that's not a problem. So you're good there. All right.
And
What
then
else we got, guys? Oh, go ahead.
I have another question too.
All right.
And I mean, I'll disclose it. It's actually me who had the surgery, so I'm wanting a little bit of clarification. But
Sure.
so I have I had breast cancer with reconstruction from the abdomen. So the
Yep.
abdominal scar really is hip to hip.
Yep.
But the tightness that I feel is actually not necessarily where the scar is. The scar mobilization that I've been doing since surgery has been very effective in loosening skin on the superficial layers. It's deeper. So do you still do it along the scar the way you described? Or is it appropriate to do in other areas where the scar is not, but I can tell that there's tightness?
Sure. You can certainly do it in those areas. And for you, what I would recommend is taking the white cables, taking them from the vagus nerve stimulation kit. So let's see if I can use my little acupuncture doll here. So I'm going to stick this electrode on here like this, okay? And
Mm-hmm.
I have it connected here. So what I'm going to do is I'm going to put this, you would put this on your back, and you only need to connect one, okay?
Oh.
But then you're going to treat across the tummy. So you're still using two of these on the areas of the incision or other areas. But what that's going to do is that's going to draw the electrons through you. Does that make sense?
Mm-hmm.
So in
Yeah.
doing so,
Wow. Okay.
that allows you to get to the really deep adhesions. That's what you can't get to with the manual scar mobilization. Like, to give you an idea, like, I'm a manual therapist. I've been doing manual therapy for 30 years. What it would take me, what I can do in 20 to 30 minutes with this would take me weeks of manual therapy work to accomplish. Like, it's not even close. And you can't get to the deep stuff with your hands the way it's an electrochemical thing. Your hands are a very poor conductor of electricity. So if you use microcurrent on those scars, it is a huge noticeable difference. And if you've had breast cancer, you got to do the breast cancer scars too. It's a major, that there are a couple of reasons for that. One is lymphatic flow. I was just teaching a workshop down in DeLand, Florida, and there was a lady in our workshop. She's a physical therapy person of some description, and she's had breast cancer. And like, when you looked at her, she had swelling kind of up by her shoulders, and we just treated right across the scars, right across the mastectomy scars, and it went down almost instantly. And all the pull in her back and all her breathing, all the tension during her breathing went away. Plus the fact that anything that stresses your system. So here's the deal, stress makes cancer worse, right?
Mm-hmm.
So stress can take a number of forms, eating crappy food, getting yourself involved in severely bad emotional situations. There are a lot of different things that can stress your system to push cancer, to make you more susceptible to it. Scars, any type of scars, electrically stimulate the sympathetic nervous system. So scars act like a battery or a capacitor. They stimulate the local sympathetic nerve fibers, not a lot, but a little bit 24 hours a day, 7 days a week. So scars, an old scar can make new pain worse. So very often I'll treat very old scars and have new pain get better. But also, scars will activate your sympathetic nervous system. And if you are trying to avoid things like, potential cancers in the future, deactivating those scars is really important. So you need to treat these scars here. And if you've had breast cancer, treat those scars up there too. Really, really important, because all your ascending energy, your female energy, runs up through here. And if you put cuts through that, you get problems. Digestive
And
problems.
it's still just the like 5 treatments or whatever. Like, how do you know when you're done treating it?
So on average, it's going to be about 5 treatments, but certainly if you had time, you could spend more time doing it. I can tell you from a functional standpoint, 5 treatments usually gets me where I need to be. Now, if I'm worried about cosmetics and things like that, then the more you do, the better it's going to look. but functionally 5 treatments usually gets you where you need to be. But hey, if you got the devices for you, just keep going until you feel like you're where you need to be. You're not gonna overdo it. You're just gonna release things a little bit more each time, and it may be that it's diminishing returns over time. So it may be much dramatic in the beginning and less dramatic later. But each time you do it, it will. And if you're stimulating all this, you're also doing vagus nerve stimulation. So that's going to help you out too. So you're kind of killing 2 birds with 1 stone right there.
So do you do the vagus stim on top of that then, or don't do the
Sure,
vagus?
you can, yeah, go ahead and do vagus nerve stimulation too.
So there's no such thing as too much.
Um,
Like, I'm just trying to gauge,
yeah,
like,
okay, so too much would be you do vagus nerve stimulation for an hour and you feel really, really sleepy and draggy, and then go try to drive 6 hours. So you do moderate it to some degree like that, but you're not going to get yourself into a situation that you've done it for 25 minutes and gosh, you've just wrecked your immune system or something. Your body either it's so little electricity that it's almost amazing that it does anything at all. Um, so your body either takes it and uses it, or it just doesn't use it. It's a very, very safe modality to experiment with, because unless you've got some kind of weird, like super weird nervous system conditions, you're just not going to see much that's going to be in any way bad. It's either going to work or it's not going to work. And depending on how accurate your point location is, it's going to be more or less effective. So the better your point location is, the better the treatments are. The more frequently you use it, generally, the better it works out. That being said, give your body a little break to recover too, because you are stimulating the recovery response in your body. So let your body do what it needs to do. So in practice, I would say doing this 2 to 3 times a week seems to be good for most people. Leaving that little bit of time in there for their bodies to adjust and reset, that's a good idea, because muscles are going to relax, proprioception is going to change at different places, so your changes how your hips shift and stuff like that, and you got to give your body time to get used to that. That being said, I've been in situations where I had people fly in from across the country, or once even from outside the country, to get treated, and I had a limited amount of time to do what I needed to do. So we did 2 treatments a day for like a week, and like it worked out okay. It's not my first choice of how to do it, but it worked out okay. All right, let's see what else we got here.
I have a quick question.
Sure.
So you mentioned not doing the Acupoints after a C-section.
No, you can do them after a C-section.
Okay, so like the spleen and everything, is that good?
Oh, absolutely. Yeah, well, absolutely. Just not while you're pregnant, unless you're trying to induce
Okay.
labor. But yeah, you would use the spleen points after a C-section because it forces energy up through there. So that's a really good thing to do.
Okay. Thank you.
You're very welcome. All right. Is someone's being okay? We've got that one. We've covered that one. Any other questions, guys?
Yes.
Okay. What have you got?
I was just wondering, will you be teaching a 2-day course? I know you said the last one's in San Antonio, but do you know when it might come up in January or?
Happy to come out and do it for you guys. Okay. Where do you live?
We're in Arizona, and I work at a med spa. We just acquired the Dolphin, the double Dolphin.
Okay.
I'm trying to learn everything and do some research, and I even watched a few of these tape shows before tonight. And
where in Arizona are you?
Prescott, Arizona. It's about north of Phoenix.
Yeah, we've been out there to do workshops. It's been a little while, but we've been out there to do workshops. So that is, that's not. I was actually in Phoenix a little bit
June
earlier this year. There was some kind of conference we went to in Phoenix. It was kind of more like a show where there were booths and stuff, and we set up there. But I love it out there. So
just getting to know, like, I want to be very good at this, and it seems this is my first foray into any of this. I'm a nurse by trade, but seems like there's quite a bit involved, and especially, like, I know you're a wealth of knowledge, acupuncture points, trigger points, all of this stuff, and I see the protocols here, but I'm more of a hands-on learner, and I know that I'm hoping that in 2 days, like, all these little tricks, like I've watched 3 of your shows already. It same talk, but I've gained something every time, something a little different every time. So
Yep.
I feel like to get a good footing on this, I should probably come do a 2-day. And so I'm working on that.
Come to 2-day, but if you're working in a med spa, like you could go right into treating scar. I'm telling you, like just practice on a couple of friends, but you can get better outcomes watching these videos and treating scars with these devices than trained professionals can get with injection therapy. It was very frustrating for me because I spent years attending all these courses on how to treat scars with my hands, only to find out like that really pretty well sucks and microcurrent works better. So I had to like, you know, eat a little bowl of humble pie with that one, but it's just kind of the way it goes.
And Joe, the other big question I had for you is like when we ordered this, we just got the standard 2 Dolphin kit. We didn't get the vagus nerve stimulator, and it seems like every one of these talks, like that's a huge focus, and it seems like it's the ultimate in getting people to de-stress system wide.
It works well.
Like, yeah,
and right now they are doing they're doing Black Friday specials now. So I think they're already offering. I think they're offering the Black Friday pricing now.
Okay.
So if you look on the website, you can probably access that.
Could you do say I had someone hooked up to the double-eared nerve stimulator, the vagal nerve stimulator? While that's happening, can I treat the rest of their body or different points?
Oh, sure. Yeah. Yeah. We have people who set that up and have them, they stretch them and they do manual therapy on them. And yeah, whatever you're going to do, that can kind of run in the background, and that's fine.
And I guess last question, just as I'm listening to all these different things you can use the NPS therapy on, I have a couple friends. One's got Crohn's, one's got some neuropathy derived from alcoholism. Have you had any success treating any of those things with NPS therapy?
Yeah.
Okay.
So Crohn's, you want to do a lot of vagus nerve stimulation.
Sure.
You want to treat the spine a lot because these are all the nerves that innervate this area. You want to treat a lot of parasympathetic calming points. There's a point on the finger right here. It's a triple warmer 1. It's in the, if you look up, they're called the Jing points, but that is for acute gastrointestinal distress. When you have a Crohn's attack, there's an acupuncture point for that. For the neuropathy with alcohol, you got to make sure they're taking like a crap ton of, they're going to be deficient in thiamine. So they need to be taking good thiamine, like all thiamine or Thiamax or one of those. Like I'm not a nutritionist and I can't tell you they need to be taking this, but I'm telling you the things that I know need to go into a neuropathy program. And the other is really good alpha lipoic acid. Both of those are really important in treating neuropathy, especially the thiamine if there's a history of alcoholism. But I've worked in programs where we've treated neuropathy from chemotherapy, from Agent Orange exposure, like all different kinds of neuropathy, and not all of it, it's, roses and happy faces. I mean, sometimes it doesn't work, but sometimes you get some really nice outcomes. And interestingly with neuropathy, you need to make sure you treat their scars. I guess it's because of how it affects the sympathetic nervous system. But anyway, that's something to do. What else?
Oh, I could go for days, but that's pretty much why I want to do the 2-day course. Okay.
Alrighty.
Just say thank you very much.
Oh, you're very welcome. Anybody else have any quick questions? Right at about 9 o'clock, and I got to go home and make sure my kids are
I just thought of something. Do you do the end-to-end with the scar after you do the 3?
Yeah, you could do end-to-end. I recommend not just doing end-to-end, but actually working through the scar itself. So start end to end, but then walk the units through the scar itself till they pass each other and go end to end again. Does that make sense?
So you do that twice. You do that twice. Once this way, and then once this way.
I tend to do it 3 times, like back and forth.
So you do that 3 times in addition to the 3 times this way.
And it really seems to be a helpful thing, because what you've done is you have repolarized all this tissue. Now you've repolarized it, it'll conduct. So you might as well work on top of it and straight through it. That seems to be a pretty good thing.
Okay. Thank you.
All righty, y'all. Well, thank you for coming out tonight. If you ever want to sign up again and take this again, I may wear different colored glasses or a different colored shirt, or, I may tell you a funny story about a patient I treated. Who knows? But anyway, we're here. Do join our Facebook forum and look for up and coming workshops with us. And I hope you guys have a nice evening, and I will see you next time. Bye-bye.